Welcome back to the Dissociative Table. I'm Alex Furchess, and in this episode, we've got the second segment of my conversation with Dr. Phil Manfield. And for those of you who have not seen the first segment of that, you can visit that to see a full introduction to him and his work. He is a legend in the world of EMDR, trauma therapy in general, and the creator of the flash technique. Possibly to many of you, he needs no introduction at all. Nonetheless, this was the segment of the conversation I was most excited about, and I'm very happy to share it with you. This is where we get into the use of flash with more severe dissociative symptoms. And in our conversation, we cover the power of laughter and the treatment of this presentation. An interaction of language between flash and my, well, as you might guess from that book back there in the background, language of the structural dissociation of the personality. Dr. Manfield presents alternatives to psychodynamic techniques, such as working with parts of self. For instance, treatment when clients have no explicit memory of childhood, treatment when there's constant abuse rather than only a few events, even preverbal trauma, attachment trauma that many psychodynamic practitioners would say is impossible to treat without methods that deal with parts of self. Or perhaps inappropriate to treat in that way. Dr. Manfield has something different to say, and we'll have guests in future episodes who present a very different perspective. I hope you enjoy his as much as I did. So regarding flash, one thing I remembered from the first training always is you said, well, it appears to just cut through dissociation. And I thought, no, that's not. But yeah, I mean, EMDR is an associative process itself. But I mentioned Dr. Vanderhart's work.
Yeah.
His concept of he's a Genet scholar, but Genet's concept of mental level is something that I work with quite a bit in terms of my resourcing and my take on resourcing and raising mental level, especially raising mental energy just by seeing what people eat for breakfast, But I've noticed that just like EMDR, if somebody's mental level isn't sufficient, in my experience, they can't do flash, or like they wouldn't be able to do prolonged exposure either. The mental level isn't present to perform that higher level action. And so one thing that I've found, and I don't know if anyone else has done this, is flash is a completely pain-free way to test mental level with a highly dissociative client. Like if flash doesn't work, it's not an epic fail. You don't present it as a cure. I say, let's just have a conversation about stuff. And every once in a while, I'm going to interrupt you, do it completely blind, which I think is remarkable. Like you could do EMDR blind, but not like flash. And if the client can't do flash, then I know, okay, like it's a better tool than the DES2 by far. And have you experienced that? Have you, what do you do with that, with a highly dissociative client? How does the first use of flash inform your treatment?
Well, I always start with every new client. I always start with history, and I don't pursue any of the targets that are presented. I just list them. So, for the same reason that you're referencing, that often they can tell you about when they were molested or whatever, but if you encourage them to give you the details, that can be very dysregulating.
Mm.
So I don't get the details on anything, but even in the history taking, it sometimes becomes clear that a client's just not capable of organizing thoughts, of following instructions, of staying coherent. And so that's where that red flag comes up for me, where I say I'm going to have to pursue a different approach with this client. I will say, as a little throw in a thought, in the advanced Flash webinar, we teach alternate ways of distracting people so that even if they can't think of a positive, engaging memory or focus, we can still find ways to distract them to the degree that they don't need to defend against dissociation. And they don't need to defend against activation, against pain. So they don't need to use dissociation as a defense. So one thing I found for these people who really have trouble with internal organization, I'll use one of these techniques. Like one of them is counting backwards from 100 by, say, sevens. And especially if people are disoriented, that's pretty tough. And we can laugh about it. I mean, I tell them, not important if you're right or wrong. And so they struggle with it, and we laugh about it. And then so that becomes the first round of Flash, maybe even the second round. But by the time we've done 2 rounds of Flash, the memory that they're focused on is partially disabled in a way. It's a way to think of it. And now they're able to come up with a true PEF, an engaging focus. And then the Flash just takes off from there and goes swimmingly.
Now, one thing that my consultees begin to notice when I have them ask some of the questions that I started asking that kind of made my career a little bit more maybe successful and disturbing at the same time, is that when they start asking about dreams, and they start asking about, well, what's the first year of childhood you remember? They find that a lot of clients they thought were not dissociative are, and that this depressive disorder or this POTS or fibromyalgia is the result of something terrible that happened back then. And now the only way I have found of working with Flash doing that, and I wanted to see if maybe this is just because I'm not good enough at Flash, and there's another way, but I originally started off with Sandra Paulson's looking through the eyes technique, and I still do kind of a take on that. But locating what people see, the pieces of child brain, seeing them as representations in their mind of their jobs, the fight character and the child character and all of that. And recently, with a woman who didn't remember the first 10 years of her life, I had her kind of line up those individuals. I'm always clear, like, look, this is not metaphysical. This is like traumatic brain injury. But line up these individuals. And I said, well, let's all select a memory. Because, with Flash, as you said in the advanced training a long time ago, you can treat 10 memories at once.
This is true.
So I treated 4 parts of self at once,
Yeah.
and it worked,
Right.
and there was no description of the memory necessary.
Right.
And I then used EMDR, and
Mm,
this cleared fairly rapidly. It's a
yeah.
single session thing, and this was complex stuff. This was
Yeah.
recent traumatic events type stuff,
Sure.
where
Sure.
you're doing recent traumatic events with something in the past that was in a very
Mm,
extended thing, like a domestic
mm,
violence situation that lasted a couple hours and
yeah.
had
So what you mean
life
by recent
consequences.
traumatic events with an old memory is
Right.
going through it frame by frame
Yeah.
and taking the whole narrative.
Right. Fractionation, so that like the mind isn't skipping from place to place.
Hmm.
Um, I am I just bad with Flash there? Do you do something different
No,
in those cases where
I do
somebody
do
doesn't
something
remember?
different. I have just become so uh, impressed with you take someone like that, and um, this may not be the case with if it's an actual single incident um, that's not reflected in ongoing interactions, but most typically these people have complex PTSD,
Mm-hmm.
and they, let's say dad was violent and dad was threatening, and you say, give me an example, and they say, I can't, but he was always that way.
Mm-hmm.
And so that's really common presentation. And of course, the client is defending against the specific examples. That's why they can't give one. But if you have them think of what all those memories have in common, it may be tone of dad's voice, the look on dad's face, the
Mm-hmm.
the paddle dad would, or the belt dad would pick up and threaten with, or it's it's usually more than one thing, but all the memories have it in common. The crazy look in dad's eyes,
Mm-hmm.
uh, and the phrase dad would say, "You're gonna get it." But um, once you identify those few elements that all these memories have in common, it's not just the memories that are conscious, it's also the preverbal memories. They all have it in common.
Mm-hmm.
And as you said, Flash is a subliminal process. It
Mm-hmm.
accesses subliminal material. And so you say to the client, well, when you think of that element that we just identified that they all have in common, how disturbing is that look in dad's eyes? Oh, that's an 8.
Mm-hmm.
And so now, we don't ask people to focus on disturbing material when we do Flash. We distract them. And so now they've thought of that look in dad's eyes, and that look in dad's eyes serves to cause the retrieval of so many memories of that look in dad's eyes. And it's all pretty much subliminal. The client isn't saying, oh, now I'm thinking of 20 times that dad did this or had this look.
Mm-hmm.
And we just distract them and take them into talking with us in this conversational style in which we're talking about something that the client gets very engaged with. And then we check back periodically to see if there's been change in the look in dad's eyes. And lo and behold, by the third, fourth, fifth time we check in, it's not disturbing anymore. And what blows my mind is that the pre-verbal experiences resolve also.
Mm-hmm.
So that's been a game changer.
The generalization aspect of EMDR has been something that's kind of converted, I suppose, a lot of exposure therapists. And But what about these cases where the client goes, okay, so where I live is a very rural area of North Carolina,
Mm,
and it's got a big fentanyl problem, a lot of
mm,
overdoses, and it's a route
mm,
for human trafficking.
mm,
Um, the police even know the hotels that get used, and I have no idea what's going on. I just try
mm,
and I treat the trauma. And my second job is evaluating um, clients for other therapists. And I find that 85%, I stopped keeping track, but it's sort of stopped at 85% of the folks here have a, regardless of the referral reason or anything like that, the primary diagnosis is some sort of trauma related diagnosis. And it's not overt PTSD in about half those cases, but if you take a look at the origins, now I would say probably 50% of those overall, regardless of the presentation,
preverbal
um,
trauma.
yeah, but not just pre-verbal trauma, pre-age 11 or pre-10. It's just a blank. It's like I'll ask a client or
Right.
someone I'm evaluating. I say, what's the first age that you remember? It's funny
Hmm.
you should ask. I've always wondered why everyone else can
Why I
remember
can't
before
remember.
10, but I don't have a
Hmm.
single memory. It's not
Yeah.
like I don't remember. It's like something has been deleted. Or
Yeah.
one touching thing about one, he had been a contractor, a military contractor, and it's seen, like there were no rules for his
Right.
unit. And he said, at age 6, there's just like a wall.
Yeah.
And doing a float back, this was a while back, a somatic bridge actually.
Mm.
And it's like there's a wall with a child behind it screaming,
Yeah.
you know? And so for things like that, I mean, the only way that I can figure out to utilize Flash, and I'll speak a little bit more, but I wanted to ask a question more about that later. But how do you use Flash with somebody who has a total blank for their childhood? Do you integrate these psychodynamic techniques, or do you, as usual, have some end around that I'm not going to be able to like even anticipate? I'm so excited to ask you that question.
Well, if you call it an end around, I suppose you can call it an end around, but I mean, I have something that I do, and I've been pretty successful with people who lack memory. You know, they certainly they lack memory about their trauma for good reason.
Mhm,
And then, as you say, often they lack memory, period. Can't
mhm,
remember anything before the age of 10. And if you massage their memory uh, in a non threatening way, you start getting memories. Um, uh, they may remember how the family celebrated Christmas. They
mhm,
may remember what the family did about birthdays. They may remember who their good friend was in elementary school. Um, they may remember what they may remember something about colors, about foods, about I mean, very non-threatening things,
mhm,
um, but usually I'm able to stir the pot until some of these non-threatening memories come up, and so people find out that they do have memories.
mhm,
And I mean, a way to think about it is that a lot of memories are dissociated. So
mhm,
maybe all the memories related to um, dad and alcohol are
mhm,
dissociated. Um, but that, but it may be that client remembers staying up with their sibling,
mhm,
listening for what was going on in the house, or something that's not traumatic. That kind of it was a bit of a success, of a victory. You know, they got to be sneaky and get away with it. Um,
mhm.
anyway, that's pretty much what I do. I seem to be able to pull memories out of people. And once I get some memories, then, and I do my low-hanging fruit, process them low-hanging fruit, even if it's not an early memory. But the combination of finding some memories that are not disturbing and also processing some vanilla kinds of disturbing memories. They embolden people. I remember a guy, excuse me. I remember a guy who he had really clear claustrophobia symptoms, but no childhood memories. No childhood memories. That he had a few, but nothing disturbing. And when we did his whole history, we got nothing more disturbing than a 3. And that was just one memory. And the rest of them were 2s and 1s. And he was in one of those fields that people tend to learn how to compartmentalize and not feel. But we processed a memory of him taking a trip to New York with his dad. His dad was going to do a sales call, and then they were going to be able to, see the sights in New York. And what was disturbing about the memory was that his dad left him in the lobby of this skyscraper while his dad went and did his sales call. And dad took longer than he expected. And the client was only 7 or something, and started to wonder if dad had come down and not seen him somehow and had left. And that was really scary. And then 12 o'clock came along, and there was just a stream of humanity coming out of the elevators, and suits going by, and he couldn't see anything. And they're just all these adults. And I won't go into further details, but it was a terrifying experience of thinking that he was lost in New York City, and that his dad had missed him. And so we processed it. I think it started out as it was one of those. It was the one that was a 3, and it immediately became a 7 or an 8 as soon as we started processing it. But the reason I tell the story is, after processing it, then he remembered being like 6 years old and playing pile-on with his friends. And he remembered being on the bottom of the pile, and all his friends were piled on top of him, and there was this pressure on him. He couldn't breathe. He couldn't see anything because it was a big pile of kids. And that's one that he hadn't remembered at all when we did the history. And that was clearly 8 or 9 for him, that memory of thinking he couldn't breathe, he was going to suffocate. And that was the beginning of his claustrophobia.
And so this is something that perhaps has, I am not, I would have to definitely recommend that only people who are very trained in treating complex trauma give this a try. But I think that you could, the application of that to what we're speaking about of just an apparent lack of memory. I would say lack of memory as ANP, or in your more like your conception's more of that Ericksonian conception of almost like an OCD type avoidance. but as I would understand it, that flash in that way, you're going after the symptom, and in treating something that is reflective of that worse, earlier, apparently not remembered trauma, you're opening up a gate with the low-hanging fruit of just tracing something that's as a 3 reflective of that, and opening up the memory in that way, in the same way as maybe a fellow with an overwhelming memory. Well, you might just focus EMDR flash on the gun
Mm-hmm.
and not the whole image. Is that
Yeah.
would that be the expansion
And
to that?
I tell clients, I tell everybody that the way I think about it is that it's teaching the subconscious that it's safe to remember things. And so, I mean, I have the experience frequently that after we process that, and that's what happened with this guy, he thought of 3 memories after we processed that first one, because he suddenly got that, gee, I can remember these things and it's not going to just overwhelm me and swallow me up.
Mm-hmm. Mm-hmm.
But perhaps that wasn't the best example, as you say. I mean, he wasn't DID, or he wasn't super dissociative.
It seems readily transferable conceptually to how you were able to locate that, because the phobia seems similar, just of a lesser degree.
Yeah. I mean, it's just a foreign experience to most people, that it would make sense to even think about a memory that's a trauma. People don't think about their traumas.
Mm-hmm.
They try not to think about their traumas. That's what PTSD is, really.
Mm-hmm.
It's a memory that a person is fighting. They don't want to think about it because they're gonna have a flashback.
Mm-hmm. I hope you enjoyed this episode as much as I did watching back through it for creating this video. My constant struggle in treating complex trauma, which is the profession that chose me, I suppose, because I just couldn't avoid it as a therapist. That struggle is, how can we minimize the pain for treatment while still retaining the maximization of the meaning of treatment? And so I hope you enjoyed Dr. Manfield's perspectives, and the next episode will take it farther. I'll challenge him a little bit. First with a colleague's question, a schema therapist. The question of, how can you treat attachment issues with Flash, or perhaps even with EMDR? How can you desensitize and reprocess the absence of something rather than the presence of something? Well, Dr. Manfield, as you might expect, has an answer, but part of that is a very touching account of his personal journey through psychodynamic treatment to treatment with EMDR, with his resulting criticisms of the former. Also, his knowledge of an integration between EMDR and schema, criticisms, ideas for improvement, Flash perspectives. And finally, I offer my own criticism, playing devil's advocate. And I'll just let you watch that because that's a fun conversation. So, as always, our intro and exit music is provided by the wonderful guys with Cracked Machine, in support of enhanced access to effective trauma treatment worldwide. Thanks, and we'll see you soon on the Dissociative Podcast.